This is our presentation on patients with hearing loss and those who are visually impaired by
Leslie Ramos.
and Giselle Zuniga. So to start, we're going to talk about management and special cautions of the patients that have hearing loss and that are visually impaired in the dental office. Starting with hearing loss, for those who are hard of hearing or people that are deaf, it's important to facilitate communication, maybe having an interpreter if at all possible. We want to be sure not to alarm the patient when using devices like hand pieces or suction, since they tend to be a little bit more sensitive to vibrations. We want to also be aware of their body language, and before speaking, tap the patient on the shoulder or wave your hand. Don't turn your back to them while they're speaking or while you're speaking. And some people who are hard of hearing may be able to read lips, although this is not true for everyone.
For the visually impaired, the level of visual impairment will alter the level of caution. Visually impaired patients need to be familiarized with the office and the environment or the clinic. Prior to the dental appointment, patients should speak with the staff and get familiarized with the staff's voices. Only one provider should talk to the patient at a time to avoid confusion. Try to reduce the amount of suctioning time, ultrasound cleaners, or other distractions to not alarm the patient. If needed, make sure to discuss guide dog accommodations in advance and provide direction and a description of the office with ample time before the dental appointment.
Drug interactions. When it comes to people with hearing loss, sometimes when it's sudden, they can be treated with steroids that are injected directly into the middle ear, usually prednisone. Steroid usage can lead to the overproduction of cortisol, and this is especially true under stressful situations, such as for a lot of people visiting the dental office is a source of anxiety. But there are no contraindications for dental treatment with the use of prednisone.
This is not applicable for visually impaired.
A few social factors that may affect the patient. The National Association for the Deaf says most medical training programs fail to adequately prepare medical staff to effectively communicate with the deaf individual. Additionally, healthcare is routinely inaccessible to deaf people because of communication and linguistic barriers. This is aggravated by the fact that providers don't make an effort to ease communication by acquiring an interpreter beforehand.
Not all visually impaired people are legally blind, thus they're still able to see something and not have it be pitch black. Not all visually impaired people have a superior sense of hearing, almost as if it's to compensate the lack of vision, which is not true. Not all visually impaired patients can read Braille, and not all blind people need a guide dog.
How dental services should be conducted or not conducted. When it comes to people with hearing loss, we want to speak loudly and clearly. Remove all background music and other loud noises. Address the patients directly without their face mask on if at all possible. Use an interpreter if available, and make the patient feel comfortable by showing that you're here for them and that you're willing to accommodate their needs.
For the visually impaired patients, you want to make sure to offer large print health history forms. Interview the patient to obtain information and understand how to make it a more effective appointment. Dental appointments should be kept short efforts to help the patient build a rapport. Please make sure not to make any assumptions. As we continue to make advances, our hopes are to be able to offer more options for patients with disabilities like OHI Braille brochures. And of course, for the hearing loss patients, literature is going to be more attainable for them. So if you've been paying attention, we want to ask you a few questions. A 27-year-old male patient calls the office and would like to schedule a new patient appointment. He mentions he has a vision impairment. What should the front office receptionist offer the patient? A, schedule appointment as normal. B, provide short appointment at first and then gradually increase the appointment time once patient has been familiarized with the office. C, not gather further information from the patient as you will help the patient fill out the paperwork. Or D, make sure the patient speaks with the doctor at the same time to ensure the doctor is aware of his medication in order to reduce the amount of questions between the staff.
And another question, all of the following are appropriate measures to ensure the comfort of a patient with hearing loss except A, avoid startling the patient with ultrasonic or hand pieces by tapping them on the shoulder and showing them what you are going to do. B, make sure to speak loudly and clearly. C, refuse treating the patient until there is an interpreter present. Or D, be aware of what they are saying with their body language.
And the results are coming up. Number 1, if you pick B, that is correct. You want to make sure that the patient has a short first appointment in order to get familiarized with the staff and floor plans of the office first in order to feel more comfortable. Then gradually the appointment can be increased.
And for number 2, the answer is C. An interpreter is not necessary in order to treat a patient with hearing loss, although it is ideal to ensure good communication.
That concludes our presentation. Thank you for your time.
Thank you.